Now, on Health Today, we're looking at drug resistance. Why do medicines suddenly stop working for you? Yes, that's the question. And doing justice to that, of course, is Kenneth Etuk Akpan, a pharmacist with over 7 years' experience in clinical and community pharmacy, drug supply, chain management, and digital healthcare. It's always a pleasure having a conversation with you.
Thank you so much. Thank you.
Fantastic. So I know we've tried to touch on different areas when it comes to medicines, but one area we touched on weeks ago and decided we would definitely have to expand it upon is resistance, drug resistance.
Right.
So now let me even start from what causes resistance to medication.
So resistance to medications can be caused by two different things. It's classified into two major areas. So people behavior, right, and also the bacterial behavior. So people behavior means the behavior of people towards medication. So it could be drug misuse, drug abuse, and drug overuse. Right, that's
misuse, abuse, overuse.
Overuse,
okay.
Right. Then we also have the bacterial behavior. That's there's an inbuilt mechanism in the bacteria in which they mutate in their DNA and everything, which causes the bacteria to become resistant to medication. Right. So those are like the major categories in which resistance can occur.
Okay, so let's talk about the second category, because
Right.
I know over the past few weeks we've talked about the abuse, overuse, and also let's focus on the other one.
Okay, so for the bacteria, so there's something called mutation where the bacteria begins to change its structure, and as a result of that, it does not allow the antibiotic to work in its cells. So as a result of that, the bacteria is not eliminated from the human body, right? That is called, it can develop into resistance. So there's also another thing, like I said, it's embedded in the DNA of the bacteria. There's another type of resistance in which the bacteria just closes its cell walls and doesn't even allow the antibacterial to come into it. So as a result of it, the bacteria is not eliminated from the human body. So that is why it's so important that we actually stick to how we take our antibacterials, because any slight change could cause this bacteria to actually mutate and cause the resistance to occur.
So when we talk about antibacterials, now, what sort of medication are we looking at?
Also, we are talking of antibiotics in general. So we are talking of the augmentins, the Flagyl, all that. So
anti-malaria features as well?
So anti-malarials are anti-parasitic because they eliminate the parasites of the malaria in the system. So those are anti-plasmodium, anti-parasites.
Yeah. So
they're antimicrobials. So microbials is the general term for which fungals, for bacterial, viruses fall under. Okay. Right. So but biotics, that is bacteria, biotics is for bacteria.
Okay.
Yeah.
Okay. So now when we talk about anti-malaria, I want us to touch on anti-malaria in particular. So when we talk about anti-malarial, you see a situation where people treat themselves for malarial up to like 6 times a year. So the usual thing is they'll ask you, when you go to a pharmacist, when was the last time you got treated for malaria? If you say 3 months ago, you're told go back home. But many people use it like every other month. In fact, it's like chewing gum these days. You have it, use anti-malarial.
Yeah.
Now, what happens, how does using anti-malarial so often become a situation where you start using it, doesn't have any effect anymore?
Yeah. Anti-malaria, that's a very important question, because especially in this zone where we are, where it's a malaria endemic zone, so we are prone to having malaria very often in the year, right? But at the same time, not just every symptom of malaria, it's malaria. It's so important that one has to get laboratory tested, right, before you confirm malaria. Because once you just have any symptom and you go and treat malaria, it might not be malaria. And the result of that, you are adding to the resistance of the malaria parasite in your system, right? So it's so important that if you have any symptom, right, first of all, you get tested. Okay. And these days where it's so easy to get the sleep or the slips, right?
Okay.
For you to test for malaria, yeah. So it's so easy for you to test for malaria and confirm malaria before actually treating malaria. Because if you do not do that, it's so easy for the malaria parasite to develop resistance, right?
Kenneth, you know, besides COVID now, I dare say we have limited reasons you would have anti-malaria, you know, you have malarial symptoms.
Yeah.
So besides COVID, we are just trying to believe it's not COVID.
Yeah.
What other symptoms can you have that are similar to malaria?
So you could have body weakness, general malaise, right? General body weakness, right? Joint pains, right? Evening chills, rigors. Those are some symptoms that are very similar to malaria, but might not be malaria. It could be something else.
Could
right?
be what then?
It could be something else.
Like what now?
Right? It could be stress. It could be stress related. It could be maybe you have an infection. Okay. Right? It might not be malaria. It could be maybe a bacterial infection and you need to be treated for it. It might not be malaria. So those are different symptoms that might manifest as malaria, but it's not malaria.
Now, to the risk of sounding like I have a personal vendetta when it comes to malaria, there's another question I want to ask.
Yeah.
And it has to do with G6PD.
Yeah.
Now, many people suffer from G6PD but do not even know about it. Till they even die, they don't even know it exists. And so you see people using anti-malaria, especially certain type of anti-malaria, and then they are peeing blood, for example, and they think, hey, it's an infection. You know how Nigerians are, we immediately diagnose ourselves. What causes that?
So first of all, G6PD is a deficiency, right, in humans in which the red blood cells react to some medications. It breaks down the red blood cells. So, for example, somebody might take a medication and the red blood cells begin to break down and it's eliminated in the body via maybe urine or sweat or something like that, right? So and interesting statistics show that it's quite prevalent in sub-Saharan Africa, up to 8%, right? But it's also important there are some tests that you can do to confirm that you are G6PD deficient. And it's important that if you find symptoms like that, probably you take some particular medications and you notice that you're peeing blood or you're stooling blood.
Quinine in particular.
Quinine, anti-malaria, very, very strong anti-malaria. In those days, right? It's important you do those tests just to confirm that you're not G6PD deficient.
Okay, so as much as I really want us to touch on so many things when it comes to drug resistance, unfortunately there isn't enough time. But I must thank you for enlightening us in many ways this morning. Thank you so much for your time. Thank you.